As a radiation therapist, there are going to be weekly checks that we have to do in order to ensure that the department runs smoothly and that our patients are able to be treated correctly. So, one of those things is called chart checks. Each therapist is going to be assigned a certain number of patients. They'll usually just kind of divide it out equally among the therapists that are there full time. And the therapist will go in and check the patient's chart prior to their very first treatment, as well as every treatment after then, just to make sure that everything is in there and correct. So, a couple of things they'll do before their first treatment is verify that the treatment prescription was signed and completely finalized by the radiation oncologist. We want to make sure that any kind of quality assurance testing that was done by a therapist and by a physicist has been completed and approved and signed off. And then also, if there are setup notes and images, we want to make sure those are within their EMR system. So when the next person goes to image the patient or to see their setup, they can go in and they can see all that information without having to search for it. Every week, we're going to make sure that we have that stuff completely finalized. One thing that's nice as a therapist is if you can keep like an Excel spreadsheet, or if you can have a physical kind of check mark box where you have the patient's name and then you have a check mark for everything that you need to do, and you can put the week by it. So that way, from week to week, most things are not going to change. So if the prescription's already signed from day one, you don't have to ensure that it's done 5 treatments from now. That's still going to be finished. But things like the source to skin distances or additional images, any additional setup notes, those types of things may change from week to week if necessary. And this is just going to reduce the risk that something might be missed overall. Because if you're assigned to it, then you know you got your patients finished, and then every other therapist should also have theirs completed. So if something is missing, like your source to skin distance numbers, you can say the next time that they're being treated, hey, we need to get source to skin distance numbers from that patient. And something you can actually do, at least within our system where I was, that in the true schedule for the day, so you had, from top to bottom, all of your patients and what time frames they were. If you knew that you needed the therapist to get the source of skin distances and maybe they're on a different machine than you, or maybe you're out for that day, you could go into the actual schedule and on their appointment time, put in there as a note, make sure to get SSD numbers. So that way, when they pull up that patient, when they come in for their treatment, they say, oh, okay, so and so made sure to put in a note that we need to get these numbers. That way, things are just very well communicated throughout the whole process. Here's an example of what a patient's chart might look like. And so there are areas in here for us to go in and see any kind of medical orders all throughout here. And you can see their flow sheet, which is what they have open over here. So you can see all the different medications they might have been prescribed, any extra questionnaires, documents, lab notes, all those things we might need. And then also over on the left-hand side, you'd be able to see your patient. They would say what their diagnosis was. And then also we have a picture of them just to verify that who we're looking at is the right person. We would also be able to see what imaging they typically do and the last date that they had that certain type of imaging. It would say who the oncologist was and their referring physician, all that information. And we'd also be able to see any kind of setup notes, things like that we need to click on. So this is the chart that we would go into and monitor all this information, make sure things are signed, notes are in here, and any kind of questions we might have, we'll be able to see the information within this page somewhere within a certain tab. I tried to find another EMR type situation where you might be able to see some information. So this is just another version of something you could find, has a patient's name, their birthday, all that information, and they would have a picture again up here. You'd be able to see what they call it an active problem. So it would be what is their diagnosis and what kind of treatment will we be doing. And it would have all of their information within here. And then off to the side is where they have more of their tabs. So you can click on all those to see if you need something, and any kind of notes that somebody might have put in about the patient. But this one was not a true radiation oncology EMR, but this is similar to one that I have seen. So I wanted to just give you a couple options for what it might look like. Another tab that we're going to have that's specific to radiation oncology is we should have an imaging area that we check for each patient. And so what happens is once our imaging has been done for that day, it is stored back into the patient's chart, and the radiation oncologist is assigned to go in there and verify any kind of shifts or modifications. And so when they go back in and look at these, if they think that one day we did too much of a shift. So let's say our maximum that we can shift is 3 millimeters and we shifted by 3.5. They could leave a note in there saying that they don't approve of that. They would rather us reposition and then go ahead and image again from the beginning. A lot of radiation oncologists don't like it when we do too much shifting with the table. So they can go in and identify that. They also can say if for some reason, when we think that we have our all positioning set up. So on here we have our digitally reconstructed radiograph and then our x-rays that we took. So this is a DRR, and then the wider portion is the actual x-ray we took that day. And then the green that's overlapping there, that is our volumes. Let me get a green. So this volume here is what we're overlapping between those images to make sure the anatomy is in the correct location. So if the radiation oncologist goes in there and they say, oh, well, I know you guys tried your best today, but I would really prefer if we moved the planning volume a little bit closer to this area, or maybe we are trying to avoid more of the rectum. So if you have to split it because maybe the rectum's a little bit more full than we want, they can just give some recommendations on what they would prefer in the future. So even though that treatment's already happened, if there's something they want us to modify or change just slightly moving forward for when we image, we overlap, and then we shift the patient, the radiation oncologist will do that. So just another area, because when you log in, it'll either say, it'll have this check mark by it, or it'll have this kind of red cone, red traffic cone. So when your images pop up, if they all have a green check mark in the corner, that means everything was good. And then if they had a concern on something, let's say they didn't like this, it would have this here. And so we would click on it and it would say any additional notes that the radiation oncologist had. And so we could change those for future reference. Another weekly item is going to be what we call chart rounds. So once all of our therapists have done their chart checks and the patients have met with the nurses and the oncologist, done everything for the week, we will have a meeting of all of us. So we're going to have the entire team, the radiation oncologist, the nurses, radiation therapists, dosimetrists, physicists, social workers, dietitian. So many people are involved in this process. And from there, what we're going to do is we're going to go around and we're going to talk about every patient that is currently being treated and then every patient that may be coming to get treated. So they are either going to meet with the oncologist or they have already and they're ready to be simulated. Or we could talk about patients that maybe had a cancer a while back and something has returned. And so they are going to come back and have more radiation treatment. So the goal of all these people is to discuss the patient's overall well-being. So let's say we have a patient that we're treating and they've gone and seen the nurses and the doctor and they say everything's going fine, but then because we see them every single day for treatment, they may tell a radiation therapist that, oh yeah, I guess my throat's been bothering me a little bit, so I haven't been eating quite as much. Sometimes they're a little bit more open with us on occasion because we see them every day and we build such a strong rapport with them that when they only see the nurse or doctor once a week, they may just be, I guess, a little bit more nervous to share information. And sometimes it seems almost backwards to the way it should be because the doctor's the one that can prescribe things for you, but sometimes they will just confide in other people. Another thing is that if they tell one of our team members, whether that's the nurse, doctor, or us, that their throat's hurting and so they're not eating as much. So the doctor can either prescribe medication or we can also have a dietitian talk with the patient about their options for soft foods or drinking more of their calories instead of having to physically chew things to help them continue to have normal weight balance throughout the entire process and to make them more comfortable. Another thing could be if they tell us that they've been really struggling to try and get to our appointment time like as soon as they need to be, or that maybe they're losing their daily ride because their daily ride is a family member and they no longer can do that time. They can talk with us therapists to figure out a different scheduling time if it would work better for them, or we can work with a social worker to try and see if they can get public transportation, if they can get some other type of transportation to us, anything that's possible for them. Other concerns we could mention, that maybe we noticed something about the machine. So maybe it didn't pass a couple things this morning that it should have been. At that point, we also can talk with the physicist or discuss treatment plan things with the dosimetrist that maybe we're having trouble with this breast because it's really, really tight on the elbow. It seems to have a hard time clearing. Occasionally, they might rework that treatment plan, or that's just something they can keep in line for the future because dosimetrists are very detail oriented. So the next patient that they have it may be similar to that, then they can make sure that maybe they're looking at that when the beam comes around to make sure it doesn't hit the patient's arm. Just small things like that. But overall, it's a big discussion of how can we make our patients' lives easier, more comfortable, and what we can do to stay strong as a team. So I already dove into this on the last slide, but as I mentioned, we'll talk about the different treatment plans, their chart, making sure that's up to date, making sure everybody's doing their job with that component, transportation, if they have a support system, or maybe they don't have people that help support them. So can we get them set up with a psychologist? If they need some type of physical or mental health kind of support, whether that be medication, food changes, or if they need to see a psychiatrist, overall just patient well-being is, like I mentioned on the last slide, it's our goal. We are very patient driven. We're a team environment. We have to have these conversations and making adjustments to patient schedules as needed, any kind of special patient considerations if the oncologist is saying that this new patient's going to be challenging or just wants something completely different than they've ever had before. They can go ahead and mention it at that time, or talk about one of the patients that is returning and say, this one's going to be a little bit different. Any kind of quality assurance they may still need done, or talk with the physicist about, when do you need to do your next monthly check? Because those take a while. And so you don't want to be caught in the middle of patients and then they say, I need to do my monthly check because you're going to be behind. So working together to schedule things and working as a team. I want to reiterate that in radiation therapy, the team environment is a crucial part of healthcare because we are working together all at the same time to make sure that we meet those patients' needs and ensure quality care. So, if we are not communicating back and forth with the nurses or the radiation oncologist, we may not be doing the patient justice because if they need medications or if they need to be seen, we need to make sure we make that our top priority. And so everyone feels included in this team environment. Everybody's just as important as each other. Without one another, we cannot make radiation therapy work. So we have a lot of collaboration. I will say in radiation therapy, it is the most included modality that I've ever been in because you work side by side with the doctor and they know you by your first name. They appreciate everything that you do, and then you appreciate them as well. The one that I had when I was doing my clinical experience was phenomenal. He was so funny and he was more than willing to teach everything that you had questions about. He would slow down. He had great patient care. And then all the radiation therapists, like we have to work together as a team. So it's not, oh, you get to do that patient. Oh, you do that patient. No, it's we work together. We're not just doing one individual per person. We're working together. And sometimes we would get 3 or 4 therapists in one room if we needed assistance, and we just make it work. Everybody knows every patient. It just was such an included modality. Same thing with your social worker, your dietitian, your dosimetrist, your physicist. everybody feels welcome, and it's such an included environment. So that was one thing that I really enjoyed about this modality, because we did things as a group. So if we wanted food, everybody got food for lunch. And if we did snacks, we were thinking about each other. If we did a gift exchange, it wasn't just us therapists, like everybody was included. A lot of people would dress up for these types of events, and even as a student, I was very included with things. I know student wise that can change per facility, but I was the only student. So it was wonderful, because if they got Five Guys for lunch or Buffalo Wild Wings, they'd always ask me what I wanted as well. We'd eat lunch together because we'd all take about the same lunch break. The doctor would come in and just have a normal conversation with you sitting at the table. So it was very different than what I was used to in some other modalities, and I really enjoyed that team environment. So then what's next for the patient after we have done all of their treatment and we've done all the things, we've checked all their charts, we've finished everything out? That means a patient could be completely finished. It could have been a possible curative situation for the patient where they're done. But they also could have other treatments to follow, like if they now are going to go have surgery or chemotherapy. Every cancer and type of patient is going to be different, and the extent of the disease. So we could be their last stop, or we could just be the beginning, or somewhere in the middle. And so it's important to treat patients with respect throughout their entire process, because you don't know what lies ahead for them. And even if we did think that it was curative, and then, a year down the road, they have something else that pops up, and then they're returning to us. So everybody's journey within cancer care is vastly different. So in this last PowerPoint, I also wanted to include information about how to become a radiation therapist. So this is going to require the completion of an accredited degree or program within radiation therapy. So you will have to have didactic education. So that's your actual academic textbook being a part of the program. So that'd be like your first year here if you were doing the X-ray program. And so you're going to have coursework assigned to you. You're going to have your concepts like the different procedures, oncology simulation and treatments, your safety and patient care, all of those academic textbook type education. And then you're also going to have your clinical experience. Many radiation therapy programs combine this with their didactic education, so it's all done at the same time. And for clinical experience, you do have to log hours, which can vary based on your program. But most places, you're going to be doing about between 10 and 12 months of clinical experience, and I'd say about 30 hours per week. Maybe that's a little much, maybe 28 to 30 hours a week of actual clinical experience. And you do have to complete 16 competencies, so 16 different types of treatment procedures. And so those kind of vary. And one thing with radiation therapy is it's a little bit different than, for instance, like X-ray or CT. There's kind of not as many options for the treatment procedures, and you have to complete 16 of them. They can be in different categories, but there's like certain stipulations on what you can count versus what you can't count, because it has to be a certain type of treatment. So it's a little bit different than some of the others. And you don't have to do like an entire patient's treatment. So what do I mean by that? If patients have 40 fractions, you only have to do one of those fractions to count it as your competency. So you don't have to treat the entire patient 40 fractions in order to count it as one competency. It's just one treatment that day is what you'll count. So after you've completed your program and you've been signed off by your program director, you are then eligible to sit for your ARRT radiation therapy exam. There are 230 questions on your board exam, and they are broken out by patient care is 46, safety is 51, treatment procedures is 103, and then your pilot questions, there's 30. So those pilots are just like any of the other board exams where you don't know which ones they are, and they don't count towards your overall score at the end. So the patient care, safety, and the treatment procedures are what are actually going to go into your final score, but you do answer 30 other questions somewhere throughout. And I know I've mentioned it before, but I'm going to mention it again. Here are some qualities of a very strong therapist: somebody that has strong compassion for their patients. And while you are compassionate, make sure that you are using empathy rather than sympathy when you are working with your patients, because the patients don't want to feel pity, but they want to know that you understand what they're going through and you're going to do your best to do your job correctly. Being detail oriented, there's so many little things in radiation therapy you got to be on top of. So while we do move at a pretty quick pace, understanding that it's important to do it right and to not miss those little things. So if you take a few seconds longer per patient to make sure you've double checked everything, completely fine. And part of that is time management as well. So don't spend too much time talking with the patient that you can't focus on your job, or ensuring that you did do your job with these small things like getting your images, your source to skin distance, making sure your shifts are correct, all those things. Having strong interpersonal skills is also important, because you're going to be doing a lot of talking with your patients, a lot of communication with your coworkers, and that goes straight into teamwork. You have to have communication to work with each other and to make it a strong work environment so the patient gets the best possible care. And then technical skills. So it kind of goes back to that detail oriented, but making sure you're checking all your boxes, double checking your work, and just being very technical about things, and including what you need to do in order to give the patient the correct treatment throughout, and make sure that they don't have any questions. You want to answer all their questions and make them feel comfortable throughout their exam. This profession can be challenging in some ways, especially it is physically demanding, just like with X-ray and CT, you're moving patients constantly. So helping the patient on the table and then adjustments, sometimes, especially me because I'm short, when my patient's on the table and I'm trying to align to my lasers, sometimes they're up higher than my chest or at my chest. And so then when I'm trying to shift their body or roll them towards the other side, sometimes I'm just lifting at a weird angle. So it's important to make sure that you know your body's limits and you don't try and push outside of them so you can take care of your body. It is also mentally challenging. I feel like working in rad therapy, my brain was probably the most tired out of all of the areas that I've been in, because you're constantly shifting focus on all the technical things and just double checking a lot of things. So it can be kind of mentally challenging. And then I think along with that is your patients are going through a very challenging time. And so sometimes their attitudes can kind of rub off on you, but it's in your best interest to try and, take every patient as a new procedure, ensuring that you know that they're just going through a hard time. And while you want to try and make their day better, some people you just can't. So you're going to do your best you can. Reading their room is really important. So if you know that patient doesn't like to really talk much, that's okay. You don't have to talk their ear off, because it's probably going to make them more upset. But if you know that you can talk to a patient, please do so. Make their day easier. And then, of course, if you lose a patient, if they pass away, that can be very challenging. Um, it's really important to have a positive mindset and remember that you did everything that you could for them within your job, and that they knew that they were important every time that they came in, trying to make sure that they're seen as patients. So a lot of patient care that goes into rad therapy compared to many other modalities that I've been in. You're with them for longer, more fractionations, and so it's just a very important part of the job. I will say I felt like it was very rewarding being in this field, because when you work in other areas, you may see a patient for 10, 15 minutes and then you may never see them again. Maybe some of the smaller town facilities, you might see them quite a bit, but in rad therapy, they keep coming back and keep coming back for numerous weeks. And so it was very rewarding to see their progression and to evaluate their changes and see even if a tumor shrunk, like that was very rewarding. And to know that we helped either cure them or helped take away some of their pain and their challenges. So I felt like it was a very rewarding field to work in, and that's why I'm passionate about talking about it and helping others pursue this career. This profession can also open doors to further career choices. So if you wanted to be a lead therapist, you could move up into that role. I know many people move up into being a lead therapist or even like a director in that area. And then if you wanted to go on and be a dosimetrist to actually make the treatment plan, that is a great opportunity as well. There are many programs out there for people to choose to do that. Um, and then there also, of course, are going to have to be educators within radiation therapy programs. So if you ever want to go back into education and teach about radiation therapy and actually do it every day, but on the clinical side of things, you could do that as well. So there are many opportunities still to kind of grow within the profession. And I think a lot of people, if they get into rad therapy, they either stay in the field or they choose to educate others about it, or they become maybe a dosimetrist. They like to stay in the area because it's such a very wonderful team environment, and just a great career overall.